I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar, and recently this article came out talking about Kathy Bates and her decisions around pain medication after breast cancer surgery, and I wanted to talk about it. Those of y'all who know me a little bit know that I am a huge fan of Kathy Bates, and she is one of my personal heroines. In the article, it talks about how Kathy Bates underwent a double mastectomy in 2012 when she was diagnosed with breast cancer, and how painful the recovery was. Back in 2012, we did have more limited options in terms of pain control after mastectomies, and we weren't using something called PEC blocks, which we use today. A PEC block is a local anesthetic injection that gets done after you're asleep typically, but before the surgeon starts. The local anesthetic that is used is often something called Exparel, which lasts for 3 to 7 days. And that local anesthetic allows you to receive less opioids during surgery as well as after surgery for pain control. So nowadays in 2025, we rarely admit patients for pain control after a double mastectomy, but back in 2012, that was pretty much the standard. Kathy Bates goes on to talk about how she did get opioid pain medications, and she asked her surgeon for a refill of them, and he said no, and she's really grateful now because she sees how she could have tipped into opioid use. And the PSA from her interview talking about this 13 years later is to talk to your surgeons about pain control and whether or not a block is going to be used before you sign up for having surgery. If your surgeon doesn't mention a block and doesn't have a good plan for your pain control, or tells you that the plan for pain control is just giving you opioid pills to take after surgery, that is not a good plan in 2025. And if I were you, I would seek another opinion talking to a surgeon who does offer PEC blocks for their patients to make your recovery much easier than Kathy Bates was. Thank you, Kathy Bates, for shining light on this incredibly important topic.